I'm delighted that here today, via Zoom, is Professor Sam Scarpino from the Northeastern University in Boston. Sam is a professor of marine and environmental sciences and physics. He directs the Emergent Epidemics Lab, whose research spans a broad range of topics, including infectious disease dynamics, forecasting and predictive modeling, disease genomics, and outbreak surveillance, to name a few. He and I have just been having a fabulous conversation. We're shortly going to have a discussion about some of Sam's research, how it'll play a role in the Trinity Challenge, and how you too can get involved in the Trinity Challenge. After all, the challenge is a unique opportunity to submit your best thinking to the toughest questions in global public health for a prize pool of up to £10 million. So, let me ask you, Sam, there's increased activity looking to the field of sewage surveillance. And as you know, I'm very excited about this and that you at Northeastern University are taking a leading role. Can you explain to us, firstly, what this is, and secondly, why it'll help us keep better prepared for this and any next pandemic?
Absolutely, and thanks very much for having me. I'm really excited to both be a part of the Trinity Challenge, but also to be having this conversation today. Briefly, the idea behind wastewater surveillance is quite simple. When we are infected with a virus like SARS-CoV-2, the causative agent of COVID-19, or when we're infected with a bacteria, we shed evidence of that viral infection in our urine and in our feces, and that flows through the sewage or wastewater system in the city or town that we live in, or it flows into our septic tank if we live in a rural area and aren't connected to municipal wastewater system. And by capturing those signatures, in most cases they're fragments of viral genome or bacterial genome, by capturing those signatures, we're able to look for the presence of COVID-19 in a population of individuals in a non-invasive way by simply sampling from the sewer lines.
Very exciting. So you can look for things you know might be there. Do you think it relates, when you find it, to the number of cases or the stage of disease? Or is it just there or not there? Are we going to get more information, in other words?
Certainly, the goal is to try and quantify how many individuals are sick with a particular disease in the population. Now, you might imagine that that can be quite complicated. We'd have to understand something about how much viral genome an individual sheds, how long or how stable that is in the water. If they're shedding infectious virus, is it potentially replicating in the water? There's certainly no evidence for that for SARS-CoV-2, but there may be for other things of interest. And so all of those things build up quite a bit of uncertainty. And so where the science sits right now, we have very good tools for detecting presence absence, and we are developing the machinery and the statistical algorithms necessary to translate those into an estimate of case counts.
Fascinating. So here we are, all learning that data and better use of data is going to be critical to our fight against this and the next pandemic. And what I'm finding interesting as we talk about this and go forward is that when we say data, most people think about health data, including electronic health records, claims, data health surveys, as the list goes. But you and I also think about non-health data. And an example of non-health data that gives us huge insights would be human mobility data, geospatial mapping companies, the likes of which provide apps for our phones. And they aggregate by way of their business. And they've got enormously significant data on how populations and communities move on a daily basis around the globe. Similarly, we know that financial service companies understand now, through advances in payment technologies, where and how we spend our money. Tech companies and universities, amongst others, are working hard to generate important insights from this data and more. Often it's commercially held. So my question to you, Sam, is how can we make better use of already publicly available data? Can you give us any examples? And how could we use these data to prepare ourselves for the next health emergency?
Well, one of the reasons why I'm so excited about the Trinity Challenge is that it's bringing together individuals that have both expertise in different kinds of data sets, but also access and familiarity with using them for different operational decisions. And so whether that's a tech company that's generating, storing, and using mobility data, or whether, to go back to the wastewater surveillance, it's working with individuals like my collaborator, Professor Amit Pinto, who's an expert in understanding how we actually capture that information from the wastewater. So these sorts of international, interdisciplinary collaborations that cross between public, private, academia, for-profit, nonprofit are really going to be essential for solving these big problems. And of course, that's part of the premise of the Trinity Challenge. From my perspective, for publicly available data, often the biggest barrier is that it is spread across many different locations. It is not uniform in the way that it's encoded in terms of the variables that are used. Even things that seem relatively straightforward, like how the dates are written down, can end up taking hundreds and hundreds of hours for researchers to normalize before we can start running any analytics. So I've been a part of a working group that was originally called the Open COVID-19 Data Consortium, which we have rebranded as global.health, which is a little bit easier to say and remember, and kind of also represents our larger focus of beyond just COVID. And what we've been developing is a suite of tools to take publicly available, anonymized individual level case data and make that readily accessible and interoperable for anyone that's interested in using those data.
Fantastic. You can see I took a note. You told me about something I needed to know, so I took a note. Thank you.
And we're listed on the Trinity Challenge data page through the data portal, but it's under the old name because we're getting ready to have a big launch probably at the beginning of December after the US election, so that there's some news cycles available for us, hopefully. And then we'll transition to this easier to remember name.
Oh, great. A lot of people find that data catalog really useful, and we developed that listing because academics asked for it, and it was a pull from the academic sector. We don't know what's out there. Help us.
Well, that's a big problem, right? Just understanding what is available and what do I need to do in order to get access to it. You know, from the academic side, from the university side, we need to sign a data use agreement if we're going to use data from a technology company, and understanding what data use agreements are common, what is an appropriate request with respect to privacy, what are best practices on the legal side. All of those sorts of questions are very hard to answer if you both don't know what's out there and you don't know what other people are doing. And so just the sort of convening power of the Trinity Challenge is really going to help individual researchers, academic institutions, private sector companies leverage additional data sets as a part of their work around COVID-19 or in the future other health threats.
Thank you. So, of course, we're delighted about that we're working together. We've got a lot of founder members. And what I want to say to everyone who's listening in today is we're excited that we've opened applications to the Trinity Challenge. We've had quite a few come in already, Sam, I'm pleased to say. The first phase we're in is really important. It's about helping people find what data's there, building challenge teams. So, listeners, do you have a great idea or a great solution in mind, or a paper you've been working on that aligns with our themes there? Identification of disease risk, response to disease transmission and spread, and recovery of our health and economic systems. If so, come on, now's the opportunity and the moment for you to share with us the Trinity Challenge, your initial concept, and see whether you can help get together in a team, and our founding members can help accelerate your ideas and thinking into true global public goods. And as a reminder to all our founding members who are leaders across the academic sector, and include, of course, Northeastern University, but other great leading institutions too, We have in our ranks global tech giants, startups, financial service companies, and not-for-profits. They're ready to hear your ideas as well as the ones coming in from everywhere else, and to work with you to figure out how they can help you drive your ideas forward. At the moment, we're not looking for finished articles and global goods. We're looking for the idea that we can build on. Actually, quite a number of ideas we can build on. There are going to be multiple challenge teams. As always, there's lots more detail and information on our website, thetrinitychallenge.org, and you can reach out through that to our Secretariat team, who are more than happy to help explain the details. The deadline for this current phase is coming soon on November the 8th, so have a look, join in. And with that, let me say a sincere thanks to you, Professor Sam, our fabulous tech team who are always on hand to help me with these things, and to you all. Good luck. Do bring your ideas in. We look forward to seeing them come through and help the world be a better place. Thank you.